All right, and everybody, Andrew has asked that we just speak very loudly because he's streaming. So. Okay. Speak very loud. Okay. All right. Thank you all very much for coming, especially on such short notice. My name is Julie Mayfield. I am the state senator for Senate District 49, which includes Asheville and about half of Buncombe County. We are here today to allow elected officials and community members to express their response to the letter that became public last night, the formal censure from CMS to HCA about conditions at Mission Hospital. And I just want to say that everybody here is speaking for themselves or whatever group they identify that they are speaking for. For myself, I am speaking today on behalf of our Buncombe County delegation. So that's myself, Representatives Eric Ager, Caleb Rudow, and Representative Lindsay Prather, who could not be here today. With the recent finding of an unprecedented 9 immediate jeopardies at Mission Hospital by the Centers for Medicare and Medicaid Services, we now have confirmation of what our community has known for years, that HCA is failing to run Mission Hospital in a safe manner. In 2019, HCA bought a world-class hospital with consistent 4- and 5-star patient ratings. Today, Mission Hospital's patient satisfaction ratings are 1 and 2 stars, and federal regulators are threatening to withhold Medicare funding due to severe deficiencies that put patients' health and safety at risk. Since HCA bought Mission, there has been an exodus of more than 200 physicians from our community. Countless nurses and staff have fled the hospital for better places to work. Attorney General Josh Stein has filed a lawsuit against HCA for failing to meet commitments it made to secure the purchase of Mission. And now CMS has issued this unprecedented censure. It all points to one thing. HCA has consistently chosen to put profits over the well-being of patients and our community. We find ourselves in this situation due to calculated decisions that HCA has made on a daily basis to increase their profits by cutting services and staff. And in so doing, they have created unsafe conditions and made the hospital an extraordinarily difficult place to work. I want to pause and say an enormous thank you to the excellent medical providers and other staff who continue to soldier on every day at Mission, providing care under exceedingly difficult circumstances. The failures cited by CMS are not failures of the hardworking, dedicated staff. Instead, they represent a systemic failure by HCA to provide the resources and supportive, respectful culture needed for everyone at the hospital to provide the best care possible. That has to stop today. If HCA is unable or unwilling to put the health and safety of our people first, then it's time to find a company that will. And let me be clear, this community will not stop our advocacy, and we will not quiet our voices until Mission Hospital once again provides world-class health care and the public's trust and confidence in our hospital has been restored. Thank you very much, and please welcome Buncombe County Chairman Brownie Newman to the podium.
Thank you, Senator Mayfield. Thank you all for being with us this morning. When the community found out that Mission was being sold to HCA, from a practical standpoint, the decision had already been made. The management of the hospital met with the community to tell them about the decision, not to listen to the community. We were told that HCA acquiring the hospital would result in better health care for the people of Western North Carolina, because HCA could bring administrative efficiencies that would lower overhead costs, freeing up more resources for direct patient care. Unfortunately, that's not what happened. Instead, HCA has dangerously understaffed the hospital, siphoning off resources to increase their profits at the expense of the health and safety of the people of Western North Carolina. We appreciate the investigation from the North Carolina Department of Health and Human Services and Centers for Medicare and Medicaid, which identified unprecedented failures by HCA to meet the minimum federal standards required for the provision of health care. The Buncombe County Commissioners will continue to take action to challenge the unacceptable and unlawful practices of HCA. Incremental steps or face-saving reforms are not enough. We need to go in a significantly different direction. The Commissioners want to reiterate our appreciation and support for all of the frontline workers at Mission Hospital, including the physicians, nurses, and all the staff who show up every day and work hard to provide essential care to the people of Western North Carolina and who advocate for change from within. I would like to now introduce Esther Mannheimer, the Mayor of Asheville.
Good morning, everyone. Thank you. It is not our pleasure to have to be here before you today at such a monumental moment for our community. I think I expressed for all of us how frustrated we feel with this process and having very little control and oversight over it. The city and Buncombe County have taken action along with Brevard in filing a lawsuit against HCA to do what we can to try to push the needle for better care and services for the people of Asheville, Buncombe County, and Western North Carolina. It is critical, not just for our health and well-being, to have a functioning hospital that can provide the highest quality of care to our people, but also for our overall health of our economy. You cannot have a thriving city and county and region without core healthcare services that are being provided at the greatest level possible. That is something that employers look at. That is something that people who live here in this area consider when they're deciding whether to stay. I personally receive a lot of communications from people who share with me their experiences in the hospital. I will say, and just to echo Senator Mayfield's sentiment, this is not a shortcoming of the dedicated staff that work at the hospital and throughout the healthcare system that is run by HCA. I personally have seen it. I've been with family in the hospital a couple of times this year, and I can see that the resources are short, the staffing is too short, the dedication is there, but folks are tired and they need more resources and more staffing to be able to provide the quality of care. And we've been saying this now for several years and nothing has changed. So we're hopeful that this wake-up call, if you will be the catalyst for something significant that will really change the way care is being provided to people in Asheville, Buncombe County, and Western North Carolina. And with that, let me introduce the Mayor of Brevard, Maureen Kopoloff, and she will be our next speaker.
Good morning. I'm Maureen Kopoloff, the Mayor of Brevard. Brevard is a small town of 8,000 people located in Transylvania County. The Transylvania Regional Hospital, owned and operated by HCA as part of the Mission Hospital System, sits in the center of our town. Every man, woman, and child in Transylvania County relies on this hospital system. Our regional hospital was built by our community. Men and women contributed out of their paychecks year after year to build it. We were proud of our regional hospital. We knew and trusted the healthcare professionals that worked there. And we knew that when our healthcare needs couldn't be met locally, that we were supported with greater, more specialized services at Mission Hospital. 5 years ago, we put our trust in HCA to run our hospital system and to provide quality health care to all of Western North Carolina. We entrusted them with something precious, with something irreplaceable. That's the health of our families. Almost immediately after HCA purchased Mission Hospital, we started to see a decline in access and in quality of care due to the corporate policies and leadership priorities of HCA. The fact that quality of care has now declined to the point where our families face immediate jeopardy when they go to Mission Hospital shouldn't be a surprise to anyone. Because for the last 5 years, the patients, the families, community groups, along with physicians, nurses, and elected officials have all raised the alarm about the dangerous decrease in the quality of care throughout the Mission Hospital system. These concerns were repeatedly relayed to HCA leadership, all the way up to Mr. Sam Hazen, the CEO of HCA. And I know because I met personally with Mr. Hazen to discuss my community's concerns. Unfortunately, these voices of concern that have continued unabated for the past 5 years were met with silence and denial by HCA. The trust we started out with has been destroyed, the safety and health of our communities jeopardized. And I also want to emphasize that these issues are not a reflection on the physicians, the nurses, the healthcare workers, the staff at the hospitals. These individuals have worked diligently to provide the care needed under adverse management conditions created by HCA. They are actually the heroes in this very sad saga. I am both relieved and horrified at the immediate jeopardy findings by DHHS and CMS. Relieved that the appropriate oversight agencies have stepped up, documented the extreme level of medical jeopardy, and demanded immediate change by HCA. But I am horrified. I am actually heartbroken that our hospital system has declined to this dangerous level. DHHS cited 9 specific instances resulting in immediate jeopardy. Let's not make the mistake of thinking of these as numbers. These are people. These are individuals who turned to HCA when they needed help the most, when they were sick or injured, when they were in pain, when they were frightened, when they were vulnerable, and HCA failed them. HCA has failed all of us. So I am here today to join my voice with that of the other elected officials, with the community advocates, with the physicians, with the nurses, and with the regulatory agencies to demand that HCA immediately start putting patient needs above profits. But you know, we need more than just small changes. It is not going to help to put a Band-Aid on this gaping wound that we have at our hospital system. So what we really need is for HCA to make heartfelt, transformative, systemic changes to both their management practices, their leadership values, and their corporate culture, because that's what caused this dangerous situation. And if they can't or they won't make those changes, then it is time for HCA to step aside and to let somebody else run the Mission Hospital system. Thank you. The next speaker I would like to introduce is Holly Jones, representing North Carolina Attorney General Josh Stein.
Thank you. I'd like to share a statement from Attorney General Stein regarding CMS's determination that immediate jeopardy conditions exist at Mission Hospital. This latest news about HCA Mission is extremely alarming and reinforces my deep concerns about the quality of care people in Western North Carolina are receiving at HCA Mission. I appreciate CMS and DHHS for their hard work to improve the situation for patients. I will continue to do everything in my power to protect people's health care, including continuing to vigorously pursue my lawsuit against HCA Mission. And with that, I would like to introduce Deborah Miles from the Health Equity Coalition to join us.
I'm going to read a statement from the Health Equity Coalition of Western North Carolina. The intervention by the Center for Medicare and Medicaid Services is the final proof, if any was needed, that HCA can no longer be allowed to put at risk the health and welfare of the people it is supposed to serve. Because a major source of revenue is threatened, HCA will no doubt address, for the time being, the deficiencies cited by CMS. To right the ship, it should begin by listening to its own nurses and other medical staffers who have sounded the alarm for years, and to community members who rely on it for their health care. Beyond that, the Health Equity Coalition of Western North Carolina urges HCA in the strongest possible terms to immediately seek a qualified buyer among nonprofit hospital systems. We call on federal, state, and local officials to do everything in their power to bring about that result. The breadth and severity of the deficiencies that impelled CMS to act are shocking, but not surprising. Horror stories have poured out of the hospital since HCA took over in 2019. In all that time, HCA has never taken significant action to stop the unconscionable deterioration of services at this once proud hospital system. Denial, deflection, and platitudes were its standard response. Today, that game became untenable. The findings by state and federal overseers boil down to this: the actions of HCA's corporate leaders have repeatedly put patients' health at risk. The price of its cost-cutting is tallied in human suffering and human lives. But bad as things may be, the region's premier hospital cannot merely shut its doors. Mission Hospital must remain open, and it must have competent leadership that understands its obligations to the community and respects the dedicated healers it employs. HCA has demonstrated beyond any shadow of a doubt that it either cannot or will not step up to the challenge. Staffing adjustments and procedural fixes may temporarily bind up the specific wounds identified by CMS, but 5 years' worth of bitter experience points to a change of ownership as the only way to bring the health of the system back to full health. Thank you. And with that, I'm going to introduce Reverend Missy Harris, the minister and former Mission Hospital chaplain.
I'm co-pastor of Circle of Mercy congregation here in Asheville. I grew up in Silva and have lived in this region my entire life other than the few years that I was in graduate school in Atlanta. I worked as a chaplain at Mission Health for 5 years, spanning the time before and after HCA purchased our healthcare system. Having roots in this region, I have had deep respect for the healthcare offered at Mission Health for my entire life. We knew and trusted that specialized healthcare needs that could not be attended to in our community hospitals, in the outlying communities, that those needs would be provided at our regional health center, Mission Health. However, since HCA's arrival, this is no longer the sentiment of people of this region. Those who have the resources to do so consider going to places like Charlotte, Winston-Salem, Greenville, Durham, Chapel Hill to seek specialized care that used to be readily available and accessible here. Those without resources to do so are stuck with whatever HCA does or does not offer. First and foremost, I want to state that the people who continue to work day in and day out at Mission Health are doing the best that they can to care for patients with what HCA gives them to work with. These faithful staff continue to hold together the primary and largest hospital system in our region, and they do so in spite of HCA's failure to live up to the promises that they made to the people of Western North Carolina. Those of you who have been faithfully providing the sacred work of caring for people in body, mind, and spirit at Mission, I want you all to hear this very clearly. We see you, we support you, and we need you to keep doing the work that you're doing. Thank you for staying the course. even as it is likely taking a toll on you and your own well-being. You have a firm commitment from those of us who stand here now, responding publicly to multiple situations that have placed our healthcare system in immediate jeopardy, that we will not be silent in the face of any efforts to place the burden of responsibility on individual staff who are holding our hospital together at the seams. These failures are HCA's failures alone. As a former chaplain at Mission Health and in my role as a pastor in this community, I have had plenty of opportunities to observe firsthand the ways in which HCA's cost-cutting measures have created and led to dangerous, harmful, and in some cases, life-altering or life-ending situations for patients, families, and hospital staff. Our coalition is made up of people who are doing our best to represent this local community and region. There are retired and currently practicing physicians among us, nurses, clergy, elected officials, and other concerned community members who have come together to raise our voices collectively to demand that HCA be held accountable for the profit-centered, shareholder-enriching practices that have left our regional healthcare system fragmented and in disarray. HCA's actions have placed Medicare and Medicaid funding at risk. If these situations are not addressed, what is already a disaster will continue to deteriorate, placing our most vulnerable members of our community in an even more precarious situation. One of the key commitments of my faith is to care for the vulnerable members of our community, and I usually find myself doing so in not so public ways. I'm not usually the one who ends up behind the microphone. But the situations that I witnessed at Mission under HCA's leadership have been troubling my spirit since the day HCA arrived. I saw unconscionable things happening there due to HCA's constant understaffing and failures to provide the staff with resources that they needed to do their jobs. I find myself being able to do nothing other than standing here today to call upon all clergy and people of faith, and honestly just calling on every person who is a citizen of this region to stand with us in this critical moment, to tell your stories. HCA must accept responsibility for their mismanagement of our healthcare system and resources, and the damages and harm that have resulted from their profit-seeking practices. We know that some movement has happened to begin addressing some of the problems and issues, and for those gestures, we are grateful. However, we won't settle for temporary Band-Aids that make the currently named problems disappear to simply check off boxes for CMS and DHHS. We demand the full restoration of Mission Hospital to the standards of care and provision of services that this community knew, trusted, and depended upon prior to HCA's purchase. And one last thing, HCA. Your recent marketing campaign could not be more aptly timed. As we drive around town or walk through the halls of the hospital, you proclaim with great pride, or what I can only imagine were very expensive, flashy signs, banners, and billboards. Your slogan, it shows. In light of these 9 egregious immediate jeopardy violations outlined by CMS, you might need to make some adjustments to that campaign. The true values of HCA really are showing, and they're not the values that you've painted all over this town. We, the people of this region, are ready for you to show us something different. We will settle for nothing less. We are paying attention, and we will not back down. Next is Dr. Mike Messino, a retired oncologist.
Good morning, I'm Mike Messino, an oncologist that's been here for almost 34 years. Started the practice, which now has my name. And I'm pleased to be able to at least speak for some of the physicians and some of the people from my group. Since the sale, or takeover, depending on what your perspective is, there have been considerable responses in quiet circles and more recently, very vocal statements. Clearly, after years of pointing out the problems with management of Mission Hospital by HCA, the agencies tasked with safety and quality have reviewed and now have brought some of these issues to bear. This is not HCA's first mismanagement of Medicare and Medicaid. It is very clear that HCA is unable to manage a large tertiary care safety net hospital in Western North Carolina. HCA, which is used to buying up failing hospitals and making them mediocre, took a very high-grade hospital on the level sometimes of university hospitals, and very quickly, placing profits before patients, cut staff, cut programs, and the trust of the people of Western North Carolina. They have no regard for institutional memory. That memory that took years to reach excellence and was vital and respected all parts of the region, cut many of the programs without concern of the people who relied on them and the people who expected to get these programs at Mission Hospital. An untold number of staff have left Mission, and if it were not for the dedicated physicians, nurses, and other support staff that have tried to continue to give excellent care despite the lack of support by the administration of HCA, this hospital would have folded long ago. There's been no regard for the current and past hospital leaders who took years to build programs to support the people of Western North Carolina, altering and in some cases destroying these programs. Because of the severity of the findings of CMS, statements like, and I quote, "There are no excuses for our patients receiving anything other than exceptional care," end of quote. Or, quote, "Significant HCA healthcare resources were deployed to assist with our responses," end of quote. And finally, HCA attributes persistent complaints about HCA's management and the litany of other issues at Mission Hospital to vocal critics who have minimized or ignored our positive impact and our achievements. After years of patient, staff, and community leaders pointing out many problems, CMS has confirmed what we've all known, touching only on the tip of the iceberg. It is time for this organization to move on, and this is not the first time I've said it. They need to be replaced by a nonprofit group that will care for the staff of the hospital and for the people that it has served so well in the past. Thank you. Carrie Wilson, one of the nurses, Mission Hospital, representing the nurses union, will now speak. Carrie.
Good morning. I want to say thank you to all of you standing up here with us today, and to Senator Mayfield for helping put this together. So my name is Carrie Wilson. I am a lifelong resident of Western North Carolina and a cardiac nurse at Mission Hospital for the last 8 years. I'm one of the nurses who helped bring this information to the proper authorities, including North Carolina Department of Health and Human Services in the form of quality complaint letters. I have witnessed Mission go from excellence to failing our community. Under Legacy Mission, we did not have nurses protesting outside the hospital or writing to regulatory agencies. We did not have politicians speaking out or lawsuits by the Attorney General. We did not have stories of danger of our hospital on national news, and we did not have immediate jeopardy. I can confirm that HCA has reduced staffing to dangerous levels. Hundreds of nurses have resigned because of working conditions, and that many doctors, radiologic technologists, lab personnel, CNAs, and more have left because of the moral injury resulting from HCA's staffing models. I can confirm that the ER has at times resembled that of a third world ER under the leadership that is put in place. I know that HCA fails to maintain an adequate supply of medications, equipment, lab supplies, and basic hospital supplies. I know of times where patients have had to utilize services such as Grubhub because their meals were so late or completely missed. But even now, while under the threat of a lawsuit from the state attorney general and many lawsuits that I can barely count, facing a loss of Medicare reimbursement because of the egregious manner in which the hospital is staffed and run, HCA leadership is cutting staff, flexing nurses that could be helping in other roles as our CNAs struggle to care for 20 or more patients apiece. Even now, HCA leadership is cutting IV team nurses on our night shift, limiting our ability to respond to emergencies. Leadership was informed that these changes are dangerous, yet they are willing to gamble with people's lives to pursue maximum profits and enable a climb of the corporate ladder. The hallmark of a good hospital is excellent patient outcomes, but that has ceased to be the focus here since the acquisition by HCA. I agree with the North Carolina DHHS and CMS report that the conditions at HCA comprise a clear and present danger to the patients because of many factors. It is true. All of it is true. Thank you. And now, speaking will be John Nicolay.
Good morning. I'm here to speak on behalf of those people who are relatively new to Asheville. My wife, Ada, and I moved here about 2 years ago. Like many people in that circumstance, we looked at a number of locations, but we chose Asheville. Like our peers that make that same decision, there are numerous factors. You all know this. Things like climate, geography, transportation, livability, economy, and of course, healthcare. But more specifically, when you're in your 60s and 70s, trust me, access to quality healthcare is number one on your reason for coming. We might not need it right away, but we know we will sooner rather than later. 21% of Buncombe County's population is over 65, and for years this community has ranked highly on a national scale as a place to retire. That is in jeopardy. Ada and I are not alone. In the past 2 years, we've met numerous people just like us who have moved here from around the country. California, Florida, New Jersey, New York, Ohio, Illinois, Minnesota, and for that matter, Canada. In light of HCA's local and national performance, Ada and I have begun to question whether we made the right decision. And in numerous conversations among our other newcomers, we find that they too are concerned with the care that they and others are receiving at Mission. They too are questioning their very move to Asheville. And frankly, in just the past 2 days, I have learned of 2 couples who have left Asheville, moved out of Asheville because of HCA's performance, and 1 couple from Miami that was almost ready to move here pulled the plug on even moving here. They were fearful that they were taking a risk in coming here. I know that I'm talking around the fringe of growth in our community, and I know in some circles in Asheville maybe that's a sensitive subject, but I happen to firmly believe that growth is necessary in order to build and maintain a viable local economy. Similarly, when corporations look to relocate or expand, such as places like Western North Carolina, the quality of health care for their future employees is a consideration in their very site selection. This all works together for the right outcomes. So yes, I'm saying that HCA's current performance at Mission, if not permanently corrected, is a threat to this region's long-term economic viability and health. We must get back a strong, highly functioning Mission Hospital to be at the heart of our community in the Western North Carolina region. Just a couple months ago, a senior HCA official was telling me in no uncertain terms that they had no problems, they were getting high rankings, and he was tired, quote unquote, tired of hearing anecdotal stories to the contrary. I wondered at the time how many of those anecdotal stories would have to be lined up in a row before he would decide he had a problem. Well, it would appear now that CMS and DHHS have a differing opinion about problems at Mission. And now HCA's very own recent quotes, similar to Missy's comment. They are busily addressing issues that just a few months ago I was told, in no uncertain terms, they didn't have. I went home that evening after meeting this person and told Ada at the dinner table, Ada, I think I've met the problem. This report from CMS is the beginning of doing whatever it takes to get Mission back to what this community and Western North Carolina needs and deserves. This is about our future.
So those are all of our speakers. I think we're happy to answer some questions if folks have them. Yeah, Kim. And you can address your question to anyone.
There's a lot said here today. Thank you for speaking, nurse. The letter says that HCA Mission has 23 days. Today, they are supposed to give their plan of correction. Is that correct, according to the letter?
That is correct.
Can we talk about just the logistics? When it comes to patients, are patients going to be at risk of being unable to go to the hospital and have reimbursements for very expensive surgeries or any kind of care? What are we looking at for the patients in this community?
So, that's a great question, and if folks who are listening couldn't hear it, what is at stake for patients in the hospital if they can't get reimbursement for their care? So, I have asked a lot of these questions to DHHS about the likelihood of that funding actually being withheld and the hospital being forced to close, as has happened in other parts of our region in the past. To the degree possible, they have assured me that because of the central role that Mission Hospital plays in our region, that it is unlikely that CMS would close the hospital, would in fact withdraw and withhold Medicare and Medicaid reimbursement, which would result functionally in the hospital closing. So I want, of course, we don't actually know what CMS is going to do, but DHHS and CMS are certainly well aware of the role that this hospital plays in our region. And I think they understand that closing the hospital would put us at much more risk as a region than we are right now, even given the conditions at Mission.
Okay, so that basically says that the hospital potentially, based on history, will continue to operate. There are calls now for, among many of you and other people, I think, who have experienced bad care at the hospital, for a sale. What does the contract say? What are the avenues, including a question towards Maureen, to the mayor, but also Senator Mayfield, I know you're very knowledgeable. What are the avenues going forward with these calls to ask HCA to sell this hospital?
Yeah, I'll take a first shot at that. Again, just to repeat the question, what are the avenues available in terms of ownership of the hospital? There is no mechanism to force HCA to sell the hospital. So HCA is who we have right now. It is who we must look to solve this problem. It is the entity that has caused this problem or these problems, and it is their job to fix it. And we will, as a community, I think, do whatever we can to support them in doing that. They have, to date, rejected every offer that has been made from every corner to help them. I don't know that anything will be different going forward, but there is no mechanism to force a sale. What we can say is that there are other hospital companies out there that would be perfectly happy to buy this system, including nonprofit hospitals, nonprofit hospital companies. And so I think, again, for folks in the community, we don't have to look too far to the question of what could happen if HCA sells. There is a future for our region and for this hospital system under the leadership of someone other than HCA. And I'll step back and let others answer if they'd like.
I'll comment on that too, because Senator Mayfield's absolutely right. We cannot force, we have no mechanism to force HCA to sell. However, we do have the power of the community, and we have the power of the voice, and we have the power of the truth that we are marshaling, as you can see standing here, and that you cannot continue to operate a hospital when you do not have the trust of the people, when you don't have the trust of your municipal officials, of your county officials, of your state officials, of the population, of the nurses, of the physicians. So no, we can't force them to, but we can encourage them to sell. And I'll be honest, I looked Sam Hazen in the face and I asked him to sell that hospital back to us. He told me no. But that was a year and a half ago. A lot has changed. So we are going to keep asking that question. We are going to keep offering alternatives, because the change that is actually required by HCA to really correct these problems are so substantial, and the problems so embedded in the culture of that corporation, that I'm not sure that they're capable of making those changes. So we will keep the pressure on, and if HCA wants to sell, if they willingly step up and say, we are willing to sell, then we will go into action, and we will help coordinate and find other nonprofit hospital buyers who would step up and make offers.
Yeah.
Clearly, HCA seems to be making a lot of money off the mission health system, so what's the next step if they decide not to sell, and if they just continue rebuffing all of these requests from elected officials and staff from around the region?
So again, the question is, what happens if HCA chooses not to sell? Well, I think Mayor Kopoloff is exactly right. The pressure will not stop. As I said earlier, our voices will not be silenced. We will continue the broad-based campaign of pressure to demand that things change and improve on a permanent basis at the hospital. There are so many people inside the hospital who work around the edges of the hospital, who work in mission-owned practices, who are fed up and who are making their voices heard in many ways. And so we will know if things have changed on a permanent basis at the hospital. This is not, as one of the earlier speakers says, this is not a Band-Aid. This cannot be a Band-Aid situation. We will know if these are permanent investments and permanent changes, and we demand nothing less. Anybody else? Okay, yeah.
Are there any particular, several speakers have mentioned nonprofit hospital companies. Are there any companies in particular that you would like to see purchase Mission Health?
The answer to that is no. We're not interested in putting our finger on the scale of any of that. There are a number of nonprofit hospital systems, and for that matter, university systems that operate here in North Carolina. And I think we would welcome anyone who is in that nonprofit model where there is no risk that they will put profits over people.
I will just reemphasize that, we are looking for anyone who will basically reflect the values of what healthcare is supposed to be about. And it's about people. So that I want a hospital run by a corporation, nonprofit, whatever, that provides accessible services so that you can get appointments quickly, that is high quality care, and it's affordable. And those are the three criteria that anybody coming in to make an offer needs to really address, and they need to address how they are going to be responsive and listen both to the community that they serve and the healthcare professionals that work for them. And so that's the criteria that I would be looking for with anyone coming in to make an offer.
Andrew.
So right now, a lot of nurses have told me that there's pretty profound concern that the plans that are being put in place to repair immediate jeopardy are essentially going to be put on the backs of nurses instead of administration. And that ultimately it will be a Band-Aid fix, that you'll get a bunch of crisis travelers come in, and that ultimately nurses in 6 months, 7 months, 8 months will have to go back to conditions that we saw before the investigation started. I actually want to ask y'all, what are the commitments that you can give, if any, to put pressure on administration and say, you know, if you're going to change things during immediate jeopardy now, let's change them permanently. Is there anything that you as elected officials can do?
Oh, sure. And I do want to give the nurses a chance to answer this question as well. I would say in the last, since mid-November, when we learned that DHHS was in the hospital, inspecting the hospital, I have been in frequent communication with our DHHS leaders here in North Carolina, and that will continue. We know that DHHS will be is tasked under this current regime that we're in of immediate jeopardy with continuing to inspect the hospital. Some of those will be unannounced inspections, and we will make sure that they are coming, that they are seeing, and that they are seeing the truth. Again, we have lots of allies inside and outside the hospital, and we will know. We will absolutely know if HCA is trying to fix these problems for the short term and on the cheap rather than making the investments that they need.
And just to be clear, you will be willing to support nurses who say, this is coming down on our backs, it's not coming down on administration's backs.
That's right. And I just want to say we've already seen that in the wake of the DHHS inspections in November and December. We know that HCA fired some nurses. And what that says to me is that they are interested in finding scapegoats and not fixing the systemic problems. And that is unacceptable. That is absolutely unacceptable. The people who work in our hospital are not to blame. These are systemic problems made that have resulted from very intentional decisions on the part of HCA. And again, that has to stop today. So let me invite Carrie back up.
So I just want to say, Andrew, we have absolutely already started seeing the brunt of this put on the nurses. We've been, their answer to everything is to assign a learning module to re-educate us, because that's what we need is more education that people need to eat 3 times a day. But instead of fixing the problem by bringing in staff, letting nurses like Molly, who was told she couldn't work the other day, that we didn't need her anywhere in the hospital, we could have used her to help make sure that people got their 3 meals and that it was documented in the chart that they got those 3 meals. So we're already seeing that pushback on nurses. Of course, more added to our plate to, making us the responsible one. So I'm happy to hear that you guys are willing to stand with us and help make sure that HCA makes the systemic changes that it needs to make and not just blame the nurses or the other staff for their shortcomings.
Mitchell.
So in August of 2021, there was a survey, right? No deficiencies found. In March of 2022, another survey. No deficiencies found. Now there is a survey in December, 9 immediate jeopardies. You a moment ago said that you're going to make sure that the oversight agency can have a proper evaluation of what's happening at the hospital. Can you, as an elected official and others, ensure that?
We can ensure So we will continue to flood the regulatory agencies with the stories that we hear. And we know that those stories formed some of the basis for these immediate jeopardies. We know that the stories that came from the nurses' complaints, that came through my office, that came from physicians. And we will continue to do that. And that is the way that we will continue to hold HCA accountable and continue to ensure that the regulatory agencies have the information they need to make the appropriate findings. Anybody else? Okay. Did you have another question?
Yeah, I have a question for Mr. Rudow. You know, I know that as you're running for Congress, you know, is any part of your legislative agenda going to help fix some of the issues that people have experienced here? Are there things that you think the federal government can be doing better that you would propose if you were elected?
Yeah, absolutely. You know, one, in the State House, I had the pleasure to work with Senator Julie Mayfield on a bill to try to make sure these kinds of transactions that led to the sale are fair, and the Attorney General has oversight to oversee them. I think at the federal level, you know, the reason why I'm here is, you know, we need elected officials to use their power to push and to hold folks accountable and to be there. You know, I think this is a federal problem we've seen all over the country, was the corporatization of medicine, and that putting people, you know, putting profit over people. And I think folks are fed up with it. And on the campaign trail all across Western North Carolina, you hear the same stories, that folks feel like the hospital system let them down. They feel like they're being left behind. And as we've heard from everybody here, this is about our economy and about you know, the future of this region, and it's something we're going to be focusing on. Thanks.
Kim, did you have your hand up?
Some of you mentioned the CEO, Sam Hazen, I think Mayor Kopelov did. And the CEO of Mission here in Asheville is, I believe, Chad Patrick, who this letter was addressed to. We at WLOS have requested an interview with Mr. Patrick, but the spokeswoman for the hospital could not get back to us. Do you think it's time that some of these leaders put a face to the executives who are behind the scenes? And then a second question. There's a board, I believe, a board of directors that answers to the hospital. I don't see any of those board members here. Have you had any conversations with them? And I also believe that some of the board members that currently sit on that board right now at this crisis point were on the board when Dr. Ron Paulus did this negotiation and deal for HCA. What's your message to some of those board members that were on that board? Is it time they too also spoke publicly and addressed the community?
Okay, there's a lot in there. So I would say, you know, my answer to your first question about the local HCA leaders stepping up and putting a face to this, I think that's totally appropriate. It is. I know that corporations have spokespeople. I think the public views that as the leaders hiding behind a spokesperson. And I know that that's how people view the situation here. So I think we would all welcome seeing in person and hearing in person from the people who are running HCA here in North Carolina. And your second question about the board, I'm not interested in looking in the past. What is past is past. The sale happened. We can be angry about it. Many of us are, most of us are, all of us are. It's easy for us at this point in hindsight to say that was the wrong decision and it should have happened differently, but it happened and we are where we are. As to the current board, which is made up of both community members and hospital executives, I would encourage all of them, but especially the community members who have been embedded in this community for decades, sometimes their entire lives, to listen to what you are hearing and to push the hospital leadership, the executives, the HCA employees to do things differently. And again, don't make this a Band-Aid. Make the systemic changes and investments that you have, that are required in order to fix this problem. Anybody else?
I just want to say You know, leadership comes with responsibility. And when you are in a leadership position, you have a responsibility for what happens under your leadership. You have a responsibility to step up, step forward, take the blows, admit the mistakes, make the corrections. And so I call on all of HCA leadership, not just at the corporate level, but at the local level. They should be here in person. They should be answering to the people. That is what leadership is all about. And if that is not something that they are willing to do as leaders, then they are in the wrong job. In terms of the board, that also is leadership. You know, I'm talking about leadership because when I was a commanding officer in the military, I was responsible for every single thing that happened in my command. Whether or not it was caused by a seaman, if it was caused by a commander, I was responsible. They are responsible. They are the leaders. They set the tone. They set the culture. They set the values. And they need to be here in person answering.
Just a quick comment to that. When I mentioned to you that I, not long ago, less than 2 months ago, talked with a senior local HCA person, I also, in that same time frame, spent a little time with the current local board chair. And all I'll say is at that time, he said he was not aware that they were having any problems, period.
And I will say that this is the pattern. I was on Asheville City Council when the sale happened, and I think Brownie and Esther can attest to the fact that we repeatedly asked for HCA executives and HCA leadership to come to town and talk to us in person, face to face, about what was going to happen. And they never did, right? You never met with them. Never did. So their absence in these big moments is a pattern. Andrew, did you? Oh, Kathy.
Yes, I implore all of us as a community to look at the past and the future, because when the board, from my understanding.
Actually, Kathy, let me stop you. I'm going to invite you up if you don't mind. This is Kathy Avery, everyone. She is part of the Health Equity Coalition as well, and very active in our health community here. Thank you.
Yes, I was just going to say, I implore all of us this time, looking back, because board members only know what is brought to them. And it's my understanding, working in the hospital myself, in Mission for over 30 years, and understanding a little bit about healthcare and hospital management, if they're not told the truth, they don't know the truth. But the truth that they were told, that they hung their hats on, was the fact that Medicare and Medicaid in Western North Carolina is their biggest source for a hospital, and that was not going to be sustainable in the future. So if someone told you that and you were a board member and then they gave you this, well, let's get this for-profit hospital in here to take over, because I don't know if you all know, but nonprofit hospitals have sustainability problems as well. So I'm going to go and say this. Going forward, we have to look at what makes nonprofit hospitals unsustainable, and especially in communities like Western North Carolina. Because if we don't address that, it doesn't matter if someone comes in that's a nonprofit, if they don't understand the geography and the culture and the insurance of Western North Carolina. If it's Medicare and Medicaid, and that's the basic 70%, it's not sustainable. So let's don't get back into the same problem that got us into this mess by not looking at everything. And I'm willing to support all of that. We need to be well informed about everything, because that's how the board stepped in and allowed this to happen. So boards don't know everything. They know what they're being told. And I implore boards to learn everything if you're going to be a board member. Thank you.
Great. So we are at about an hour. Why don't we just take one more question, and then I think folks will be around here. There are also some copies of some of our statements up here if folks would like them.
Just in terms of transparency, the immediate jeopardy findings were given to Mission Hospital on the 19th of December, and we've had to, the the actual notification of those have not been really forthcoming, so the public has had to be in the dark and wait while, you know, those letters sit on somebody's desk effectively.
Right.
And even now, we're waiting for the 2567 forms to, you know, help us describe why, you know, the hospital is actually in immediate jeopardy. Is there any pressure that legislators can put on CMS or NCDHHS to say these things help us, help the community make decisions about where they want to get their health care? They should be public as soon as humanly possible.
Yes, they should be public as soon as humanly possible. Again, I will, so I have been in almost daily communication with DHHS about this and about the need to release these documents to the public, starting when you, I think, broke the story about the December letter. And it might be helpful for everyone to understand the structure here. So DHHS functionally works as a contractor for CMS. All of the documents, all of the research, all of the reports, all of the letters, all of that belongs to CMS. And DHHS does not have the authority to release it without the permission of DHHS. I mean, sorry, without the permission of CMS. Thank you. So that is, the problem is not with DHHS. DHHS has been a diligent soldier in all of this work, doing the research, writing the reports, making the recommendations to CMS. It is CMS where the pressure needs to live. And again, I guarantee you, I know that DHHS is putting that pressure on CMS. In fact, the release of this letter last night came as a direct result of a phone call from the deputy director of DHHS to CMS, imploring them to release the letter for the benefit of the public. And we can only hope, and we will continue to put pressure on both DHHS and CMS to release all of the documents going forward, both the report that forms the basis of the letter and certainly HCA's proposed corrective action plan, which we will be looking through and combing through, because the people of this community will be able to look at that plan and know whether it is a Band-Aid or whether it is going to fix the problems.
Just one final question for the nurse.
Yeah.
Could you tell us how full is the hospital? From my work reporting on the business of hospitals, the hospital has to be full in order to be generating revenue and profit. Where do we stand? What's your take on that, and also your fellow nurses? Are all rooms filled?
We've seen a slight decline actually in the number of patients coming through the ER since the immediate jeopardy was announced, with the preliminary findings in December. No doubt that is a direct result of the findings in the ER and the dangerous situations there. So we've seen a slight decline there, but overall the hospital is still pretty full. We're still, fighting for beds in our ICU and trying to, get people discharged as soon as we can, as soon as they're ready, to make room for other patients. And I just want to answer a previous question that you asked about having HCA leadership, held accountable. I would love to have any of them or all of them here in front of you all to answer questions, because they play like they don't know what's going on, that they've never heard these complaints. But it's because when nurses like me and the three you see up here try to take our concerns to them, they call security and have us escorted away. They don't want to listen.
Thank you.
Julie, can I just ask one thing? Maybe you have a quick, do we know the profitability of our mission hospital? Do we have any clues about?
Yeah. And for folks who don't know, this is former Representative John Ager. My understanding, and folks in the room correct me if I'm wrong, is that Mission Hospital has the second highest per patient revenue, per bed revenue of any hospital in the HCA system. So why don't we call it at that? And again, folks will be here. Thank you all very much for coming. Really appreciate it. Thank you.
So hard.
I was like, I was sort of like, do we need to do, like, is there really anything else to say about this?
I don't know. Do you think?
I think so. I think so.
That's all I.
Well, I'm sure there